My secret hepatitis B story. I am a 36-year-old woman living in Sydney who is currently taking the hepatitis B medication Vareed. Thanks to the fact that I have been taking Vareed consistently for over 5 years, I am currently in good health with no problems with my viral load or liver function. I am a 36-year-old woman living in Sydney who is currently taking the hepatitis B medication Vareed. I don't know how you feel about me to watch this video, but I am saying with the hope that my experience will be helpful to someone. My mother is a hepatitis B carrier, hereinafter changed to carrier, so I was also born a hepatitis B carrier. As expected, there was no hepatitis B vaccine in Korea when I was born, or my mother did not know about it. The first time I heard of hepatitis B was when I donated blood for the first time while attending high school in Korea. I donated blood at a blood donation center with my friends, and a few days later, I received a letter informing me of the blood test results that told me that I should not donate blood. So I asked my mother, and for the first time, she explained that she had hepatitis B when she was born to my maternal grandmother and that I also had the same case. After that, I never donated blood again, but I also did not undergo any special tests or treatment for hepatitis B. I lived like that for several years, forgetting about it. I came to Australia for the first time in 2007, and decided that I wanted to live here permanently after receiving a permanent residency permit, so I made various preparations. In 2011, all preparations for permanent residency were finally completed, all documents were submitted, and only the final step, the physical examination, remained. At a physical examination institution, I was taking various tests and answering questionnaires that applied to me. At that time, I came across the word hepatitis B. Suddenly, out of curiosity and concern, wondering if I might fall into this category, I told the person in charge that I was a hepatitis B carrier, and my hepatitis B test and treatment began in Australia. I say this now, but in fact, at the time, I had to say that I was a hepatitis B holder, so the immigration office had to increase the additional requirements during the physical examination, prolonging the process of receiving a green card, so I don't know how difficult it was. After completing the basic physical examination that day, the person in charge of Lee Min Seong asked me to submit the results of a detailed blood test and ultrasound related to the liver and to get an opinion from the doctor about my liver condition. That was the first time I met with a gastroenterology specialist at St. Vincent's Hospital and received a blood test and ultrasound. At the time, I was 25 years old, did not drink or smoke at all, and had no other diseases in particular, so it was concluded that although my viral load was a little high, there was no problem with my liver function. And with the doctor's opinion that there was no reason to be disadvantaged in receiving a green card because of this, fortunately, everything passed and I was finally able to receive a green card. However, the doctor advised me to get a blood test once every 6 months and an ultrasound once a year. So since then, I have received blood test and ultrasound results through my GP and have been seeing a specialist at the liver clinic once a year. However, as time went by, the virus level in my liver gradually increased, and around 2016, the virus level soared to an uncountable level, so the doctor first recommended a medication called Vareed. Fortunately, all treatment, prevention procedures and medications were covered by Medicare, so there was no need to worry because there was no cost to the patient. A few months after taking the medication, I took a blood test again, and fortunately, with the help of the medication, the virus returned to normal levels. Still, the doctor instructed me to get regular blood tests since I don't know when or how the levels may change. When I moved in 2017, I started attending the liver clinic at Liverpool Hospital. After consulting with the doctor there, I was told that there would be no or very minimal problems with pregnancy, childbirth and breastfeeding if I took Vareed. I took the medication every day as usual and became pregnant with my first child. Instead, he advised me that when giving birth, I must receive an injection of hepatitis B immunoglobulin to prevent the baby from developing hepatitis B. Fortunately, I gave birth without any problems, and with the help of midwife, the baby was able to receive the injection well. Since I also gave birth at the same hospital, the liver clinic watched me with more interest. When my child was 9 months old, I drew his blood and tested to see if he was immune to hepatitis B. Fortunately, he was able to avoid contracting hepatitis B through me. Through my experience with my first child, I also became pregnant and gave birth to my second child while taking the same medication. I have been breastfeeding for 4 months now, and my child and I are doing well without any problems. I am still receiving regular blood tests and doctor consultations at Liverpool Hospital's liver clinic, and my viral load and liver function are both in good condition. In fact, I do not tell anyone except my immediate family and very close acquaintances that I am taking hepatitis B medication. It is true that the perception of the disease called hepatitis B is not all that positive, and there are many people who do not know much about it, so I tend not to talk about it. Fortunately, I have no liver function problems, so I have not experienced any discomfort or discrimination. However, it is true that I am a little discouraged by the trouble of having to take 1 pill a day for the rest of my life, and the sense of obligation to take care of my health a little more than others, including alcohol and cigarettes, but I think I have to endure this if I want to live a long, healthy life. I think the reason I have been able to live without any liver problems until now is thanks to the consultations I have had with doctors for the past 10 years. I don't know what the system is in Korea, but in Australia, hepatitis B patients seem to be managed very well, so I feel very lucky. Above I have told you about my experience living with hepatitis B. Thank you. If you want to share your story with us, please share your story with recording a video in maximum 5 minutes. We will publish in our channel that will help to inspire other infected people living with hepatitis B. You can send us through email at.
If you like this video, please like and share this video more and more. Please support our channel. Thanks for watching Great Wisdom Discover. We will meet you with new update in the next video. Thanks for watching Health Wisdom.